Hello, I'm Dr. Kimberly Kress, Medical Director of the TMS Serenity Center located in Sugar Land, Texas. This video presentation is of our clinical outcomes data first accepted for presentation at the 2013 American Psychiatric Association meeting in San Francisco and recently updated, accepted, and presented at the 2014 Clinical TMS Society meeting in New York City. TMS therapy was FDA cleared in 2008. I founded the TMS Serenity Center in April of 2010. At this time, we are the largest provider of TMS therapy in Texas. This information reviews in a retrospective study our first 103 patients since our start in April of 2010 till April of 2013. All patients were diagnosed with major depressive disorder and had failed on average 3.7 antidepressant medications in their current episode. Most of our patients had struggled for years, if not decades, with depression. In order to evaluate our success, each patient treated with TMS therapy was evaluated prior to treatment and their depression and anxiety scores were recorded. We then re-evaluated each patient during their course of TMS therapy treatment. We did this at week 2, week 4, and week 6. Then we evaluated those we could enroll for long-term follow-up from 6 months and beyond. We use well-known and accepted evaluation surveys to record this information, these being the Beck Depression Inventory Scale, Patient Health Questionnaire, and the Beck Anxiety Scale. Here are our results. This chart shows each of the depression survey's progress before and after treatment. As you can see here, the average post-score for this patient group showed significant changes in depression symptoms. The majority of our patients got better. To further review our results for reducing depression symptoms, the pie chart on the left shows that approximately 77% of patients had a positive response to treatment. A positive response is when we see a 50% improvement in their depression symptoms. The pie chart on the right shows the remission or complete relief of their depression symptoms. As we can see, 65% of patients treated with TMS therapy at the TMS Serenity Center had remission of depression symptoms. These charts were derived from the Beck Depression Inventory Scale, one of the highest regarded tools for measuring progress for clinicians. Keep in mind, these patients had tried and not responded adequately to between 3 and 4 antidepressant medications on average. We also looked at the results of TMS therapy in regards to anxiety symptoms. Anxiety symptoms showed a similar result compared to depression symptoms. The chart on the left shows that 76% of individuals had a positive response to TMS therapy. The chart on the right shows that 69% of patients had remission or complete relief of their anxiety symptoms. This is not surprising in that we know that often depression and anxiety coexist. As previously mentioned, we also reviewed our data for long-term results. This data varied in that not all patients participated in this part of the study. This is not unusual, as many patients who have achieved remission move on with their life. Our data also demonstrated that TMS therapy helped most people stay well for over a year. We followed roughly 40 individuals for a year or more after beginning treatment. Our results showed that those who have a positive response or achieved remission from depression and anxiety symptoms have over an 80% chance of maintaining their wellness after 1 year. Several patients have been tracked for 2 or more years and have maintained their wellness. Our overall results of 103 patients showed that TMS therapy had a 77% response rate and a 65% remission rate in treating those with depressive symptoms. In the same population, we tracked anxiety symptoms. Patients in this group had a significant response with over a 76% response and a 69% remission rate based on the Beck's anxiety. I'd like you to keep in mind that the patients that we treated are considered treatment resistant and have failed on average close to 4 medications. These are not just medications that were tried, but medications that were tried at a full dose for at least a 4-week period. Many of these patients have a history of other depressive episodes, which includes many other antidepressant trials. Long-term data strongly suggests that those who get well after receiving TMS therapy have a greater than 80% chance of staying well. So who can benefit from TMS therapy? In our experience, there are 3 major groups that can benefit. The first are those individuals that are not receiving full benefit from antidepressant medications. We know that roughly 1 out of every 3 people that are being treated for depression are experiencing inadequate results. The second group that can benefit are those that may be receiving relief of symptoms, but the side effects of antidepressant medications are limiting their quality of life. Fortunately, TMS therapy has minimal side effects and none of those associated with antidepressant medications, like weight gain, sexual dysfunction, upset stomach, tiredness. The last group who can benefit from TMS therapy are those who have strong thoughts about taking medications. Some individuals may consider themselves naturalists, whereby they do not want to take any antidepressant medications. Others who have medication concerns are those with chronic illnesses that are taking medications that may interact with other medications. These individuals would include those with depression that are also suffering from diabetes, cardiac, or cancer ailments, or those that have decreased kidney or liver function. The last group with concerns of more medications are women who are suffering from depression during a perinatal period. It is common for some women to prefer limiting their baby's exposure to medication while pregnant or breastfeeding. We hope that this information on the clinical success we are having at the TMS Serenity Center has been helpful. We have administered over 5,000 treatments as Texas' leading provider. Please visit our website to hear patient testimonials to understand the real-life changes individuals are experiencing when depression and anxiety are removed from their life. We have helped many who have struggled with depression for years to find new hope. We would welcome your call so we can provide more information for you or for someone you care about. Please call us at 281-240-4322 or email us with any questions at tmsserenitycenter@kimcrest.com.